Support for Conversations Live comes from the members of WPSU and from the Penn State Alumni Association, informing, involving, and inspiring Penn State alumni and friends worldwide through programs, events, and communications.
Good evening and welcome to Conversations Live, Mental Health and the Justice System. I'm Patty Satalia. Over the past 50 years, we've gone from institutionalizing people with mental illness in state-run mental health hospitals to incarcerating them. On any given day, between 300,000 and 400,000 people with mental illnesses are behind bars in jails and prisons across the United States. Another 500,000 are under correctional control in the community in halfway houses, on probation or parole. How did America's jails and prisons become de facto mental health facilities? And what are the implications for all of us? Tonight, we'll talk about that, and you can join the conversation. Our toll-free number is 1-800-543-8242, and our email address is connect@WPSU.org. If you'd like to join us on Twitter, you can tweet a question to @WPSU. Now let's meet our guests. Tom Brewster is Executive Director of Centerpiece, a charitable organization in Bellefonte that provides restorative programming and services to inmates housed at the Centre County Correctional Facility and throughout the Commonwealth's Department of Corrections. Tom also provides ongoing life skills training to the men housed in the Rockview State Correctional Institute's Special Needs Unit. Gary Lucht is Executive Director of Specialized Services at Stairways Behavioral Health in Erie, a mental health outpatient program that serves more than 1,000 clients on state, county, or federal probation or parole. Stairways is also the exclusive provider of mental health and drug and alcohol services inside the Erie County Prison, which is a 640-bed facility. John McElarney is Executive Director of Forensic System Solutions in Philadelphia, which develops and provides educational programs for professionals in criminal justice, health, education, and social service. John is also a former assistant district attorney and has trained more than 10,000 police and corrections officers on how to work with people with mental illness. He consults with counties in setting up police-based crisis intervention teams, something we'll learn a little bit more about in just a moment. Thank you all so much for joining us.
Thank you.
And I said this at the beginning of the program, and this number, it's different depending upon what you're reading, but approximately 16 to 20% of our prison population suffers from a mental illness. That's compared with 5% among the general population. Why, Gary Lucht, are so many Americans with mental illness ending up in jails and prisons?
Actually, I think the percentage is much greater than that. And I think that in any correctional facility, the amount of treatment personnel you have, from psychiatrists to counselors to certified registered nurse practitioners, people who are able to diagnose and treat, you identify a far higher percentage than that. And one of the reasons is that the states and the federal government have simply withdrawn from inpatient housing of people with forensic needs, and it's left to the counties and to the state to do that. One quick illustration, you may have 20,000 people a year going into the state prison system in Pennsylvania. In the county prison system, you have well over 200,000 that go through the county prison system in Pennsylvania. So the intake of prisoners is enormous. Identification is really difficult of the mentally ill offender. And the turnover is very high in the county prisons. So that's one, it just simply has been an ignored population.
Well, the big question is why, and I'll ask this of you, John McElarney, why have correctional institutions become de facto mental health facilities?
Well, I think obviously the good intentions we spoke about before even beginning today, just among ourselves, of getting folks out of the state hospital system, but did we provide the services in the communities, in the counties, jobs, education, access to treatment? Probably not such a good job. And now with the recent state budget cuts, and we talked about that a little bit, You have student assistance programs in schools in some counties they're cutting, so where teachers could refer a student and have them assessed and maybe enter into treatment being cut. You have mobile crisis units being cut, who may respond to schools during the school day, and shelters closing. So alternatives. So who do you call? It falls to the police, and then it may lead to the county prison or jail, when it needn't have that happen if those services were in place.
Well, the interesting thing about what you're saying is it was President John F. Kennedy who really brought the end to the state mental hospital, the state insane asylums in 1963. Here we are 50 years later, and we're spending $140 billion by some estimates on treating the mentally ill, and not very well.
Well, we're reacting, I think, to what that created. And throughout the mid-'60s and the early '70s, these people were out on the streets. They had no support network that we all can fall back upon. And so they ended up doing as best they could on the street. And with no support network, inevitably they're going to offend someone without the tools necessary to live a contributing, productive life.
Recidivism is very high among the entire prison population, but tell us a little bit about what it is if we're talking about someone who, on top of that, has mental illness, and many with mental illness have multiple mental illnesses and substance abuse.
That's right, and we don't, as a society or as a community, necessarily have the tools to deal with that. And in fairness to corrections, they have limited budgets as well. So the wardens of the county prisons, the superintendents of the state correctional institutions have their hands full. The local institution here is about 14% over capacity. So they really do have their hands full. So add to that a recognition of mental health needs, and that part is difficult in and of itself, just to recognize, not unlike we've recognized the importance for DUI courts. We need a mental health court to better identify and treat some of these folks.
There are mental health courts cropping up around the country. Do we have enough of them?
No, absolutely not. It's a dedicated court, and there can be too many dedicated courts, but certainly for that and for drug courts. Another enormous issue in Pennsylvania is the separation of treatment by regulation between drug and alcohol and mental health problems, and they co-occur constantly.
Why are they separated? What's the rationale?
There's only 6 states in the entire United States that don't have a co-occurring license, and an outpatient clinic, for instance, and we have both. We have a drug and alcohol program and a mental health program as an outpatient clinic, and there cannot be a single treatment plan, those types of things.
I'm going to take our first call in just a minute. But why are people with mental illness so easily entangled in the criminal justice system? John McElerney.
Well, I think from my experience in talking with police officers, learning from police officers, corrections officers, probation and parole, and I think that's a big point. I think we're all is we really have to talk to the folks who are running our prison systems, working on the front lines, our police officers. What's happening? Why is this happening? How can we do it better? But I think what you'll hear is a lot of folks, if I have a serious mental illness and I don't have housing or a job, and you talked about this, I may find myself out self-medicating. And that may be drugs or alcohol, that can happen. Or I have a co-occurring disorder, very common. And that may lead me to be victimized, police to be called, or maybe on criminal trespass, disorderly conduct, and those things kind of build, and I find myself in the county prison system. And the prison system's well aware that they don't really need me to be there, but they're trying to do the best they can.
Not only may you wind up in the county prison system or jail system, but you'll probably stay there twice as long as someone who doesn't have a mental illness.
Absolutely, and misconducts, I believe, right? Maybe the illness-related or symptom-related.
So if you have a mental illness, you are probably one of the biggest rule breakers because of your psychosis or schizophrenia or what have you.
You know, many are treatment refractory and medication non-compliant. So they go into the county prison system. As a result of the police can either go to a hospital and stay with you for 4 hours to see if there can be a 302 emergency commitment, or simply arrest you for disorderly conduct. And in communities where there may only be 4 or 5 patrol units on the street, That's the easier alternative, and that's not a pejorative statement to the police at all. Then you come
They have
into
limited
prison.
alternatives.
Absolutely.
And
That's
they
what
would
we need
love
to change.
do anything but.
Correct.
Bring someone into
Correct.
the system. It amazes me over the 10, 12 years involved. I really wish we had something else that we could do. And on the corrections side, we really wish we had, John could be out of the prison system, and receiving what he needs outside. But that's it, the community, really.
Right. I want to take a phone call right now and come back to what it's like for someone to be in jail or prison who has a mental illness. Our first call comes now from Susan. She's calling us from Port Matilda. Go ahead, please, Susan.
Yes, I had a comment. If you're mentally ill, do not go to Mount Nittany Hospital, because there you'll be verbally and physically abused by the guards who are posted outside your door. You'll be threatened with trespassing. The police will be called. You'll be escorted to your car without treatment and told that if you do not leave the premises immediately, you will be arrested for trespassing, becoming another person in the vicious prison cycle.
Are you talking about presenting at the hospital saying you need help,
Yes,
Susan, for a mental illness?
I told them I needed help. I needed mental health help, and they refused to give me mental health help. Instead, called the police, had me escorted out to my car. I was told to either leave the premises immediately or I'd be arrested for trespassing.
Susan, I can hear the emotion in her voice. Tom,
Absolutely.
I think you've dealt with people in this situation many times.
Well, and I think we can have a conversation here about what was missing in Susan's case, and that was there was no one apparently in place at the time that understood that there was something other than her wanting to break any kind of law. And I think that's where these crisis intervention teams come into play, because we're now beginning to train police officers so that they can begin to understand that this person is just not out of order. There's something maybe else wrong with them.
And a plea for help
Absolutely.
is what was going on there. We go to Tim, who's calling us from Center County. Tim, what's your question or comment, please?
It has been a while since I called in, but I would like, and this may have been answered by some of the people on the panel, but I would like to know how they are defining mental illness.
Good question.
What level of impairment is involved? What level of dysfunction is involved? What diagnoses? What level of difficulty are the panel members really talking about? In a strange way, you might say, are you talking about people who are a little crazy or a whole lot of crazy?
All right, good question. Gary Lucht, help answer that question for our caller.
Tim, it's an interesting question, but there are definitions. The seriously mentally ill are defined as psychotic disorders. I think it's limited to 6, but however, mental illness is a very broad area. And it can be from the neurotic disorders, anxiety disorders, to the psychotic disorders, and also that would include character disorders. But the seriously mentally ill, when you're talking about mental health issues, you're generally talking about the seriously mentally ill, and that's a product and can only be defined in Pennsylvania by a psychiatrist through a psychiatric evaluation and an ensuing treatment plan. That's how that's done, at least in the Commonwealth of Pennsylvania.
You wanted to add,
well,
Tom
but
Brewster?
when I see some of the products that end up coming to the Center County Correctional Facility, for instance, they really do range from just the clinically depressed, which can manifest itself in any number of ways. So that can build on that depression into something that's much greater. So when we're talking about mental health, I want our audience to understand that we're talking about those who are up at not the very seriously mentally ill, but also those who just are having trouble within society that need some extra understanding.
You oversee prisoners with mental illness in Erie.
Yes.
A 640-bed facility. What is it like to be in prison for someone with mental illness? I mean, what if any kind of treatment at the average prison in Pennsylvania. What treatment are they receiving?
Well, we're very fortunate in an area. Our Department of Human Services grants us $400,000 for our services at the county prison. The outpatient clinic is a licensed clinic, so we bill. It's a fee-for-service arrangement like any other outpatient clinic, but we're dedicated to people on probation and parole. But inside the prison, there's an identification process that goes on, and there's a support system that goes on. And we're fortunate to have correctional officers that are really tuned in to the mental health program. And we're not there in competition. I think that there...
You mean with outside...
absolutely.
With outside services?
Yes. There has and there always was kind of a face-off between the corrections personnel and the mental health personnel. And at one time, someone facetiously said that the corrections personnel are cuff them and stuff them, and that the mental health people are the social worker. That just simply isn't true anymore. I do believe Pennsylvania, for all the cutbacks in funding, is really recognizing the issues in the county prisons. And there has to be a participation because the Department of Public Welfare gives the money, grants the money to the counties, and they in turn granted money to the jail. I don't think that happens often in Pennsylvania, but we need more of that.
You know, oftentimes someone who is schizophrenic or has severe bipolar disorder is released from prison. So they've gotten treatment, they've been stabilized in prison. The big question is what happens after that? Sure. What groups, who is picking up the slack, providing the safety net? I know your group is Centerpiece, Tom Brewster. Well,
as the executive director of Centerpiece, I'm also a voting member of something called the Criminal Justice Advisory Board in Center County, and it's a wonderful recommending body headed by Brad Lunsford, one of the judges in the county. And we are looking specifically this year in 2013 at reentry programming because it seriously lacks. We don't know what happens to these folks when they leave, particularly if they serve their maximum sentence. If they're paroled early, yes, they're under supervision, they're under probation or parole supervision, so there's some oversight. But if they serve their maximum sentence, the door opens and they go away, and they're not under corrections control anymore.
And the big question is, most of the people with mental illness, they lose their benefits are terminated once they go to jail. So someone may be released from prison with 2 weeks worth of medication, $75 in their pocket. They were stabilized in your Erie County jail, for example, and now they're out on the street. Who's going to make sure they're taking the drugs they may need?
Well, the transition has to happen, and I would think that in most jails that's more like 3 to 7 days of medication. And the Commonwealth has 1 month, has 30 calendar days to turn the benefits back on, so there's a huge gap there. Now, there are things that a doctor can do. It's called life-sustaining meds that can be retroactively paid for.
Does the prison take care of this and make sure this happens before someone's
They absolutely
released?
should and have to take care so that you are re-signed up the minute you leave the institution.
And I think as part of this, these are medical disorders.
Yes.
They're chemical imbalances in the brain, particularly with the serious mental illnesses, bipolar, major depression, and schizophrenia. So medication is certainly critically important, and so is having other services, which you also provide, which is to educate folks with a serious mental illness. This is what's going on within you, the importance of staying on your medications, and I think our other guests can talk about there are side effects to these medications that many folks, whether inmates or not,
they don't want to be on them.
They're not going to take those medications, and maybe they don't have access to another doctor or follow-up services to say, I'm having issues, can we try something else?
If you're just joining us, I'm Patty Satalia, and this is Conversations Live, Mental Health and the Justice System on WPSU TV and WPSU FM. Our guests are Tom Brewster, the Executive Director of Centerpiece in Bellefonte, Gary Lucht, the Executive Director of Specialized Services at Stairways Behavioral Health in Erie, and John McAlarney, the Executive Director of Forensic System Solutions in Philadelphia. Our telephone number is 1-800-543-8242, and our guests are ready to take your call. You may also email your question to connect@wpsu.org. And if you'd like to join us on Twitter, you can tweet a question to @WPSU. And we go now to Jennifer, who is patiently hanging on in St. Mary's. Jennifer, what's your question or comment?
My question is about the serious mental illness diagnosis. How many of the offenders that you see have had that diagnosis prior to their incarceration or their involvement with the criminal justice system?
Gary Lucht?
I would say at least 80 to 90% have a prior diagnosis.
So you have some paperwork to say this person is coming to us and he has mental health issues.
Particularly with the serious mental illness, yes. And it's important. That information can be sought. Now you have basically electronic records among the hospitals and among the mental health facilities. And with that, your ability to react to that person's illness, you can do it much more quickly.
The question that's begged by that statistic is, why are they being sent to prison and not to treatment?
That's the question.
That's a $64,000 question.
It certainly is, and generally, the cycle that's there is a relatively minor run-in.
Sometimes public urination.
Absolutely, someone acting odd, those types of things. We have a Mental Health Procedures Act about emergency commitments and those types of things. I'm not altogether certain that's something that should be tampered with or have any kind of a knee-jerk reaction to because of some other factors. But it just simply is a very lengthy process. And although an answer has to be returned to somebody coming in and petitioning, the thresholds are very high to involuntarily commit somebody. And again, you have people that are off medication. They have difficulty in housing. They have difficulty with their families. Very often they're homeless. All those things impede effective treatment and can wind a person up in jail.
Tom Brewster, I know that you end up working with inmates when they are released, often coming to a house behind Centerpiece because there wasn't a family member who would take them in, and they can't be paroled without an address.
That's right. Certainly at the county level, we have individuals who are otherwise eligible for parole, could get out of jail, but for a variety of reasons, they've burned all their bridges. Nobody wants to deal with them anymore because of this mental illness. So as long as they're out of their hair, they're fine. But where do they go? So we house them in our correctional facilities because we can't put them anywhere else, unless someone like Centerpiece comes along and says, okay, I will take you, I will care for you, I will supervise you. And for us, they always volunteer, so it keeps them busy. It gives them some sense of self while they're out, as opposed to having idle time, which is absolutely horrific for these folks.
And if you think of the human cost, but if you look at the cost of reincarcerating and reentry, we'd be better off putting that money up front in services
into treatment
and
facilities.
Treatment.
I mean, you just talk about the money that's being spent on someone who is spending 60 days more in jail than they need to, and you multiply that over all of the prisons and jails in Pennsylvania, and you're talking millions of dollars that could be used,
and then the stress on
more
the
productive ways.
Corrections officers, the mental health staff, it's tremendous.
The public system, and I think you would both agree that if you go to a hospital, local hospital, into a mental health unit, if you're fortunate enough to have an inpatient unit in a hospital in a city nearby, that cost is pretty close to $900 to $1,000 a day. And when you take a look at what you're putting into inpatient care and what you're putting into prison costs and what you're putting into those types of arrangements, the treatment in the community, having available medications, having doctors and professionals to check on the medications, to look at that co-occurring problem. So somebody is on Abilify or Zoloft or Prozac or whatever, and they're also taking cocaine or doing meth. And those are deadly combinations, and it's extremely dangerous. So the money could be so better spent in the community as opposed to inpatient facilities.
All right, we've got a lot of calls backing up. I'm sorry for that. Ronald from Osceola Mills, what's your question or comment?
Yes, thank you, Patty, and gentlemen, I appreciate you listening to me. Real quickly, I started in the Department of Corrections at SCI Rockview over by Bellefonte in 1983. At the time, we had 9 facilities, state correctional institutions. And we did start and have a special needs unit at the time. But my question is, when I retired, we had 27 facilities, SCI facilities. At one time, we used to take inmates to Farview, which was a mental hospital. And a lot of the, at the time, the mental hospitals had up to almost 2,000 inmates. During the early 90s and mid-90s, when I was transporting inmates from Bellefonte to Farview, from SCI Rockview to Farview, there was only like 184 patients at Farview. When I came back, I said to our head psychiatrist, hey, there's only 184 patients. They used to have 2,400 at one time, and there was also another mental institution in Pennsylvania. What's going on? The head psychiatrist at the time stated, Ron, we have psychiatrists here, we have psychologists, and now we give out the medications that the mental institutions used to give out. We can give them out now at the SCIs, at the corrections facilities, and we do not need the mental institution.
Ronald, what's your impression of how that works in prison?
Well, I'll be honest with you, Patty, that there was a lot of assaults, and I don't care what institution you're in, but there is a lot of assaults because a lot of inmates, we have them going out to a medication line at the time 3 to 4 times a day for whether it's Thorazine or whatever. At one time when I started, as I stated, in 1983, the corrections officers used to give out the medications. The nurses would drop them off into the housing units, and then we would distribute the medications to the inmate with the inmate number. Every now and then, we would get a medication messed up, if you will. If one person was supposed to take one type of medication, we gave them someone else's medication. So, at the meantime... And
you weren't medical professionals to be doing this.
No, we were not.
No.
And actually then, after this happened, right around the mid to late 1980s, we continued, when we were not allowed to give out the medications, we gave out aspirin and Tylenol, and then they actually stopped that.
I'm going to have to cut you. Oh, I'm sorry, unless you have a final comment, I'm going to have to cut you off. I'm sorry, I'm getting told
One thing I do want to say, a year ago, my daughter was sent to the Center County Correctional Facility, the county jail. Real quickly, she was bipolar, and when I called and stated her mental illness to the county facility, they said, Mr. Henry, we have a psychiatrist that comes in once a week for 4 hours, and if your daughter doesn't get to see her, I'm sorry about that, they'll see her the following week. And I just feel that the county does not have the money compared to what the state does as far as,
or particularly,
mental
yeah.
illness.
Thank you, Ronald, so much for your call. Or particularly the expertise. Tell us, and I'll take that next call in just a moment. But
or that care would better be provided, and you can tell me, Gary, in the community, and not have to rely on the prison system as the fallback. And that's when there was that deinstitutionalization, late 80s, 90s, if I remember. All good intentions, new medications, people can do better and be productive and live good lives, but then did not provide the housing, the jobs, and access to medications and understanding about the illness. And, well, if we had those illnesses and those symptoms, sometimes they can drive our behaviors, and we end up in contact with the police if there's nowhere else for us to go.
Correct.
all right, we go to Wayne, who's calling us from State College. Do you have a question for our panel?
Oh, just a quick comment. I just wanted to make an observation that we're finding, you can read it on Wikipedia, but, the incarceration rate in the United States is the highest in the world. And I think the answer is because it's become big business. Right now we're talking at a budget of around $63 billion plus a year, and it becomes business. It's kind of like the gentleman's centerpiece. He's turned it into a business. But, you can work it as a 401(c) organization, but, there needs to be transparency across the boards here. And I look forward to Centerpiece actually publishing the salaries of everybody who works there so that they're transparent. Everybody can see exactly how much money is being paid for people under the guise of being a quote-unquote charity. We need to start taking a look at being overly regulated in this country and finding out what's the problem, why in the United States, out of all countries in the world, that we have more people in jail than places like China. It doesn't seem to make sense.
To 25% of the world's prison population and 5% of the world's population, so an interesting point. But I'll let you address his comment.
I absolutely appreciate your comments, and I think he's correct, and Gary's correct in that we want the public to understand why it is that we do what we do, and that's why we're a United Way agency. The United Way is very stringent in terms of where our money goes, because they will not fund us, and annually I have to produce an audit. I have to submit all of the salary information that goes along with the federal Form 990. So it's all out there because we have nothing to hide. All we're trying to do is fill in some holes where maybe the system has fallen through. And the previous question about the SCIs and the special needs unit, I mean, they still exist. And again, I think the corrections officers are doing as best they can. But at Rockview, there are anywhere from between 95 and 100 men on this special needs unit, all on some type of psychotropic meds. And in that, while they're in the block, they're somewhat protected, but these men go out into the yard with the general population, and there are all kinds of horror stories about how they are abused by other inmates out in the yard.
If you want to put a face on this, I would recommend to anyone listening or watching this evening, Frontlines The Released really gives you just a mind-blowing look at what this mental illness means in prison. One of the things I wanted to ask you about before I take this next phone call, Rick Leicht, is isolation. Because mental ill often are rule breakers because of schizophrenia or what have you. They end up in isolation. What impact does isolation have on someone with a mental illness?
It can be devastating. And most institutions, fortunately, have restrictive housing units. But strict isolation is something that correctional administrators have to take a look at, because you're actually exacerbating the problem. And if there's restrictive housing units, and there are people that are simply huge management problems and are very legitimately dangerous people, the mentally ill generally do not fit into that category. That's just simply the fact of it. And I think people are coming around to that fact. If I could just mention once in your last caller about prison being a business, he's right, and he also may be incorrect too. The reputation your organization enjoys certainly is known to me up in Erie. The 990s, the IRS 990s, are public information. Anybody can get them. So that's something that the The caller certainly is any citizen out there can find out what it is that money is going to. On the flip side of that, we have 51,000 people in the state system. We have 35,000 people on state parole. We have 35,000 people in our county prisons. We have 180,000 people on probation or parole in Pennsylvania. There are 10 federal institutions that have about 14,000 people locked up. It is a big business.
Well,
and you have to take a look at leveling that population out. And there was an article briefly that said, well, the population of the Department of Corrections is going down. The population in some of the lesser institutions, some of the less under L4 or level 4 institutions have reduced slightly, and there seems to be a leveling off. But the populations that are maximum security prisons like SCI Green are at about 120% of capacity. What might be happening is that that portion of the population that really doesn't require total confinement can be better served. And I think we may be heading to that plateau, which would be a good thing.
And yeah, you mentioned misconduct, so I'm sorry, and I just want to get back to that in the prison system. And the bottom line is that the last place someone with a serious mental illness who's ill and on minor charges should be is in the prison. It is
and in isolation, and it happens
stressful environment.
Often, yes.
So the officers and the prisons try to keep that person safe, and sometimes that requires then restricted housing or isolation. And again, as you said, that's not the best for that person. But again, the last place you want someone who is ill from a serious mental illness, if they're not necessary to be there, a violent crime or whatever, is in the prison system. It's a very stressful environment, and then that also then creates more stress for the officers and the treatment folks.
And getting back to that last caller, we do often look in this country at prisons as economic development. I mean, how often is a county thrilled that a prison is coming to town?
Absolutely.
I mean, it's outrageous. So I can appreciate his comment in that respect. Sure. And we go now to Chris, who's calling us from State College. You're on the air, Chris.
Thank you, Patty, and thanks to your guests for taking on this important topic. Immediately after Newtown, there was an article widely distributed entitled, "I Am Adam Lanza's Mother," in which a mother with a child with several mental illnesses recounts her story of trying to help get him treatment. And in one episode, she's in an emergency room in a hospital, and they suggest to her that she should have her son break the law to get into the criminal justice system because that's where he's most likely to get treatment for his mental illness. And I wonder if the panel could talk to the challenge of the front end of the pipeline, the lack of mental health treatment for adolescents who then age into adulthood and end up in the criminal justice system.
Excellent comment, and everyone was nodding their head.
Absolutely.
We've all read that article. That
Yes.
was just
Very impactful. Yes.
very impactful. John McElharney, begin with you. I mean, how do we get the mental health facilities in the community that are needed?
Well, and the caller hits this right on. It's up front. You know, I said that the old ad about pay me now or pay me later. You're much better off putting, let alone for the human goodness of it, humanness of it, but putting that money up front instead of paying the cost of incarceration and reincarceration. Somebody has to make the decision to get back to reentry. You talked about that earlier. We did a lot of that, I think, or a lot of that talk, and a lot of activity and programs in the 98, 2000, early 2000, and then we seem to have gotten away from that. So yes, we need to place more front end. The shelters, the alternatives where police officers can take someone if there's an incident involving serious mental illness, some other option other than having to take them or leaving them where they are, perhaps to be victimized, or taking them into the prison system. So I think that's what has to be done. I think we've done a lot with well, police can do this better, or they need some information, or corrections officer and everything, but I think we have to look to the mental health system or for them to find the funding to actually put those services into place, because we know the outcomes then are better for everyone, even if you're just talking dollars, but the human cost then as well, you know, for people who are ill.
Yeah, there are some who are saying we should take this responsibility away from the federal government, give it back to the states. no one is suggesting that we go back to state insane asylums, but putting the responsibility back with states. I know there are mayors in major cities who are doing phenomenal things. Mayor Bloomberg is really paying attention to the mental ill population, and it seems with good results. A 32% reduction in major crimes in New York City, the safest city in the country.
Right.
Any comments on?
And then again, you look at that, and if it falls a lot on the police or what's actually, I mean, with even stop and frisk and other things, a lot of controversy. But we just had a woman at the end of December, again, one of these kind of outlier cases, but it captures the attention of the woman who pushed a man in front of a subway train in New York. Right. A lot of history of serious mental illness and substance use and whether the system was helping or not. And now an article today I just read before I came in that the mayor has sent in the police to sort of sweep the subways of folks with a serious mental illness. Well, that's not really the problem or how to solve it. Right. It was one
brushing it away again,
right? And putting it on this, like criminalizing being ill, and that's such a small. It's very serious. I mean, and how much more serious can you get? But the problem probably was, it seems to be, lack of access to services, follow-up care, housing, and access to medications.
I'm going to come back to the question of psychotropic drugs with Gary Lucht in a moment, but Joseph is on the line from Falls Creek. You're on the air, Joseph.
Yes, Patty. My question is, this term bipolar, it seems to be everywhere. It seems, every child that can't get along in school is bipolar. Every adult that can't hold a job is bipolar. The only place it isn't is in the old psychiatrist books and stuff like that. Could one of your panel define it for me, and when does it become to the point that people cannot manage their own affairs?
We called it manic depression in the past.
Yes, we did. And I am not a physician. I'm not a psychiatrist, but certainly that is a defined illness. It's characterized generally by periods of mania and periods of depression. There were various medications that were very effective in dealing with that. But the bipolar illness, not only is it more prevalent, for whatever reason, I don't claim to know the answer to that question, but it is one of the serious mental illnesses. I would agree with the caller, John, that it does seem to be diagnosed often, but the psychiatrists that deal with that particular illness find it to be not only more prevalent, but easier to treat, and are identifying it in much better ways. And I think that's important, that it's not a scapegoat. It's not something that excuses somebody from any kind of behavior, but simply by mere prevalence. It just simply is we have more people looking at that illness, being able to identify it and being able to treat it. It genuinely is a legitimate illness.
And that's a critical point.
But I think part of his question really speaks to the idea that, suddenly kids are being diagnosed with bipolar. They're diagnosed in school at alarming rates for attention deficit disorder, or, things that in the 1950s you would have, maybe been a troubled or artistic kid, but you weren't labeled as ADD, for example.
Well, I think if you see a child, or let's talk about a child who actually has ADD or ADHD or however it's defined now in the new book that's just come out of all the mental disorders.
DSM.
And again, not a physician, not a doctor, but from experience, right? I've seen someone who has those illnesses and receives the proper medications and treatment, it's a world of difference. So now that child can use their intelligence, pay attention in class and become, the person who they would hope to be without that a barrier of the symptoms of the illness. I mean, as anything else, bipolar became sort of out in the public, I guess, more like the major depression has been for many years. So I think part of it is the newness and the attention to it. And so, of course, it's going to seem like it's being diagnosed, and maybe more, or even, which it is, or overdiagnosed. So I'm sure there's some of that in and everything. But I think it really is just recognizing that, in fact, we have folks that have these illnesses, and we're finally getting a handle on who they are, and who we can help the most, in medication or other treatment.
I want to ask this question about psychotropic drugs, but I first want to say that that violent people usually are not mentally ill, and some mentally ill become violent. Before I talk about this list that I have, which details school shootings beginning in the 1990s to the present, and it includes information about the drugs that the shooter was on. And I read through several of these and read the articles related to each of these incidents. And what I found that was striking was in almost every case, the shooter either withdrew from their medication, changed their medication, or had an increase in their medication. And that begs the question, are we too freely prescribing these powerful medicines without appropriate oversight?
I think the short answer is yes. But the other part of it is that the medications that are prescribed require a great deal of time for a person to be able to, for their particular bodily system, to be able to assimilate it. And sometimes you have to titrate up or down. Sometimes you have to wean a person off a medication. As we speak to the correctional system, often you go in and you're on one medication that is not on a prison formulary, and you're changed. And it can take 3 or 4 weeks for that change. And in that time, you start getting misconducts, and you start to act out, and those types of things. So these youngsters that you're talking about that were part of these school shootings, by and large, one can't be absolutely tied to the other, but you do have to take a look at how the pharmaceutical companies, and I think this is a big issue, where they tested on kids. And on a lot of, they weren't. And it's an adult dosage given to a child, and they'll lighten it up for body weight, but that doesn't necessarily mean it's going to be effective. You're starting to see that now in the ads, that there can be suicidal ideation, there can be aggressive ideation. So we got a lot more work to do on the pharmaceuticals. They're dangerous medications. They're not panaceas.
And as we look at the school shootings, and it's a compelling list, and the tragedy in Sandy Hook, we see the news reports and we hear Asperger's or this or that, or Virginia Tech and Cho, and right away, or Aurora, Colorado, and what. But we really can't be certain that mental illness actually drove that behavior. It could have been someone who had a mental disorder and was just so angry about whatever it was. In Sandy Hook, I'm going to have you put out of the house, I'm going to move, and may have done something in anger unrelated to a mental illness or mental disorder. So I think we just have to be careful. Even in Virginia Tech, was he just sort of angry at the world and the system, and more than anything else?
Well, that's the difficult thing, is when is punishment the appropriate treatment, and when is treatment the appropriate treatment for someone who is involved in these things.
And I think that gets back to it will come out. It'll shake out.
Sure.
I may say, oh, I did that because of a certain illness or something, but in the end, through the course of it will shake out that this is really what seemed to have happened here. It was something else.
Very few human behaviors happen as a result of one variable, and it just, well, that's said. How it is.
Okay, we go to John, who's calling us from Altoona. What's your comment or question, John?
Patty and your guests, thank you for taking my call. I've really been on 3 sides of the fence. I'm a former state trooper, assistant chief of detectives for the Port Authority, and chief of police in Edgewood. And I also worked at Graterford.
Wow.
The largest prison in the state. And what I would like to do is I'd like to see the Department of Corrections, they're going to close Houtzdale and Greensburg down. I would like, because I think we had, when I worked at Graterford, I believe we had 17 men in wheelchairs. I would like to see that type of inmate housed in one of these 2 institutions. And they're lifers, and if they would release them, they have no more family or friends. And also, the VA was totally unprepared. I'm a veteran of both Korea and Vietnam. I spent 4 years in Vietnam, and the VA is just trying now to catch up on the traumatic post-stress syndrome. And I was a caregiver for 2 years. I had one man schizophrenic, and one advanced dementia. And I'm presently a caregiver again, and it gives me a lot of self-satisfaction. But my reason for calling tonight is that the inmates, especially in the restricted housing, are there. When yes, they can lose an arm, they can lose a leg, they can lose an ear, an eye, but take away their personal freedom, and you almost turn into an animal. And these men that's in restricted housing, they're outside for 1 hour a day for exercise or shower. So, but
some
again,
even less
I would
than
like
that.
to see some movement on Houtzdale or Greensburg for these senior citizens that are inmates to be housed in one of these two institutions. Thank you.
All right, thank you for your call and comment. Multiple problems that are really overwhelming to think about. The geriatric population in prison is one that is absolutely exploding.
I mean, just on the special needs unit at Rockview, I mean, we have men in there well into their 80s
who are no risk,
who can barely make it to the shower. Why do we have him in that kind of secured location where he's no danger to anyone?
And the cost to taxpayers is much greater to keep him in that facility.
Instead of 50 or 50,000.
So now we're psychiatric hospitals and geriatric hospitals and
all the medical issues that come with aging.
That's right.
So
Absolutely.
Right.
So how do we change this broken system?
Well, there had been a push also for our older inmates some years ago, right?
Well, I mean, right now they're closing down SCI Crescent. I mean, we're in Greensburg. For some reason, they're doing that. I'm not quite sure why, but they're bringing, as I said earlier, there is a special needs unit at Rockview currently. They're bringing men from SCI Crescent who are in a secured special needs unit. In other words, these are men who are prone to violence. So they're, at least currently, I believe, are being housed in the restricted housing unit at SCI Rockview. If they'll go on to SCI Benner Township or not, I'm not close enough to that situation, but we just keep moving these men around.
We're not addressing the problem, and that's what I'm hoping we can.
I mean, we can identify. We had started, right, and there were great efforts and all the work that you're doing now to identify folks who really don't need to be in the state prison system to make room for those who do, which relieves the stress on the system in general, the officers, the staff, and treatment. And somehow did it stop, that effort to kind of get older inmates out, or the reentry?
Well, I think one of the critical issues, and there is a facility in the Department of Corrections that does an extraordinarily good job, and it's SCI Laurel Highlands.
Yes.
That really is top-notch in every regard. One of the issues that you have, and although I am for the law as it stands in Pennsylvania, life means life in Pennsylvania. And about 1 out of every 10...
You are for that?
Yes, I am. 1 out of every 10 or 1 out of every 11 prisoners in the state correction system is doing life. And life means life. And so there are people that simply have to be housed in a different way, that don't need the level of confinement, but have to be treated with dementia, Alzheimer's. It's really something, and every institution in the state is dealing with this issue. It's a big number.
Yeah, it is a big number, and I'm kind of curious. Pennsylvania, I think, is one of 6 states where life means life, and the only way you get out is with the commutation from a governor.
From the governor.
I mean, can we really afford to do this when, as Tom just said, when many of these inmates reach 50, 60, 70, they are of no harm to anybody. I mean, they're of no real danger.
I think that's a difficult conclusion to make. I do think there has to be some assurance in the criminal justice system of a consequence that for many it's a plus in that it takes away the onus on going for execution, which is something that I think people have to have. There has to be a conversation about that as well. But the assurance of the consequence, I believe, does have to be there. But in terms of how the person is housed is a different thing. If I could just for a second, you made an excellent comment about the criminal justice advisory boards. Those are huge in the Commonwealth of Pennsylvania. It's a huge step forward. It's an area that children and youth, the foster system for the kids comes into play, and also a consensus of the community and what we're going to put our money into. It's huge. I think Pennsylvania is really out in front. I believe we are.
Let me just ask a final question, and I'm sorry because there are a lot of people holding to ask questions, and I apologize about that. But this year alone, hundreds of thousands of prisoners with serious mental illness will be released into communities across the country, not just in Pennsylvania, but nationwide. Within 18 months, nearly 2/3 will be rearrested. And so I'm wondering, just final quick comments, real quick, how can we improve the outcomes?
I think we can improve the outcome if the Department of Public Welfare and the Department of Corrections and the state, there could be more of a participation between the state correction system and probation and parole system and the county. There is no money other than grants by the states into the county prisons of Pennsylvania. None, not a dime. And that really has to change.
Tom?
I think most of all, we need to educate ourselves and our communities about what mental illness is and how to identify it and how we feel about it. I think we're still afraid of that whole area, and until we come to grips with understanding it, we're not going to get very far. The other thing I believe, when these folks are coming out of these institutions, I really place a lot of pressure on our faith community. We need to have people who will wrap their arms around these folks because they have no one. And none of us could survive without our support networks around them. How can we possibly expect anything more of those folks?
Tom? Or John?
I think it's housing, it's jobs, if it is involving a medical situation or mental health situation or needing treatment, access services provided. And then I think you will see much less of that reentry in the system, except for those who decide they're going to continue criminal behavior.
Yes.
Well, then that's why the prison systems are there.
Yes.
But for those folks who would benefit from treatment, services, housing, who wouldn't, jobs, we have to do that up front. And I think we'll benefit from it as a society, as a state.
All right, gentlemen, thank you so much for joining us this evening.
Thank you.
I want to thank our guests, Tom Brewster, Gary Lucht, and John McIlerney. We also hope you will join us in March when we take your questions about community water fluoridation. I'm Patty Satalia, and for all of us here at WPSU, have a good night. Thanks for watching.
Support for Conversations Live comes from the members of WPSU and from the Penn State Alumni Association, informing, involving, and inspiring Penn State alumni and friends worldwide through programs, events, and communications.